Good afternoon. This is Channel 1 Lunchtime News. I trust you're having a lovely day so far. Well, we have a comprehensive bulletin lined up for you this afternoon. Remember, this is an interactive segment where you can reach us on our social media platforms at KBC Channel 1 or at Jackie Umbiru. My name is Jackie Umbiru. Our sign language interpreter is Lucy Maura. Now, to kick us off, well, we shall be heading over to the Kenyatta National Hospital, where our reporter Purity Museo is on standby with the National Nurses Association of Kenya President Alfred Abengo, where earlier on the Nurses Association were calling on the county governments to address the plight of health workers. Now, Purity, bring us to speed.
A very good afternoon to you, Jackie. We are here at the National Nurses Union, National Nurses Association of Kenya offices at the Kenyatta National Hospital, and they were just addressing the media in regard to the ongoing strike by the nurses across the country. And some of the issues that they are raising is the manner in which the nurses' grievances are being addressed by both the union and the Council of Governors, and also the SRC, which is the body that is mandated to ensure that issues such as the salary grievances are looked into. But just before I give you a background on how and when the strike began in the middle of a pandemic, let's speak with the president of this association to just bring us to speed on how they are helping into these negotiations and some of the issues, or let's say some of the problems, the disagreements that are going on to have this prolonged strike by healthcare workers. Thank you so much, Alfred Obengo, for joining us this afternoon. It's been 2 months. In December, strike by medical workers began, and we are facing a pandemic. They are the frontline workers, but no end in sight. You began your statement by talking about the manner in which the strike or the issues are being addressed, and now poking holes into the union and saying some of the way they are dealing with the negotiations is not the way according to the law. Maybe you can tell us what are your concerns as far as the Kenya National Union of Nurses is concerned and how they're addressing this matter.
Thank you, Purity. It is a sad state of affairs that we are in this situation today, especially in the middle of a pandemic. But what has saddened me most as the president of National Nurses Association of Kenya is the way our real issues, insofar as our welfare is concerned, have been masked by political undertones between the COG leadership and also the leadership, section of the leadership within our union, to the extent that we've seen altercation that actually are more or less, you can say, personal. And that is really not bringing out our real issues as they should be on the fore. So we wish to ask the leadership, both the parties, KNUN and the COG, not to mask our issues with their own political, probably, differences, and maybe the politics of Kakamega. So what we are saying is that let our issues, our narrative be about our welfare and our welfare only. Otherwise, if there are other political issues, let them be separated from the issues that the nurses are pushing and the health workers are pushing. So,
all right. Today you are condemning the statement by the Kenya National Union of Nurses, SG, Seth Panyako, on 3rd, where he was angrily trying to address the issues by the nurses and actually welcoming the new leadership of the Council of Governors. Maybe what specific are you calling unethical in how they're addressing these matters?
What I'm bringing forth is not really even condemning someone, but what I'm bringing forth is just reminding the public, reminding our health care professionals, and specifically the nurses and midwives, that we still have a profession and we still have some ethical virtues to observe, even in the midst of an industrial relation process. To the extent that even after this industrial action, we'll still go back and serve our patients. And one of the cardinal duties that we've taken oath to preserve is that we must never divulge confidential information that you are privileged to be in custody of as a nurse or a healthcare professional. We must not do that in public, because that impinges negatively on it also stigmatizes the people that have actually offered you that information. So that one, we still want to remind the public that they should have confidence in us. We still want to remind them that let them still come to us, and that is an isolated incident that must not happen again in this profession, because we are not allowed to divulge our clients' personal details, health details in the public or in the media.
And what the association is saying is that leadership is lacking in negotiating and trying to address the issues by nurses. So how best should they be addressed? It's been 2 months, and patients are really suffering in the public hospitals affected.
The other confusion that has been there, it's more or less to define the role between the national and the county governments as to who are supposed to handle this and who is supposed to handle that. We've seen a situation whereby there was also misunderstanding of the law by various players, that what should have been handled at the county level, you've brought it to Nairobi for maybe the CS Mutai to handle. What should have been handled by probably CS, you've taken it back to your county government to handle. So we need to separate issues that need to be handled at the national government and at the county government level. And most of those issues, if you have looked at them, 99% should have been handled at the county government, because the human resource component, so far as administration of the human resource is concerned in the healthcare industry, is under the county government. So it's let our people be wise enough and explore those avenues that are available insofar as handling their issues within their respective county government.
And lastly, are you in support of the industrial action, and how best should your grievances be addressed?
And the industrial action or any industrial arrest or any strike is supported by the Constitution of Kenya, of which His Excellency the President himself actually took an oath to protect. So the industrial action is there in the Constitution, but it should also be governed by some laws and some regulations. And having said that, we strongly feel that the biggest source of the industrial unrest, the confusion within the healthcare sector, is Salary and Remuneration Commission. Because the Salary and Remuneration Commission has failed to live up to its mandate of actually bringing fairness insofar as remuneration and payment of emoluments is concerned. They were supposed to bridge the disparity, but they are widening that gap even more, because you can't understand how a doctor and a nurse who are attending the same patient, maybe even in theater, they are doing surgery, that a doctor will be paid 20,000 and the nurse will be paid 3,000, and yet the same blood from that patient they're operating, actually all of them are exposed to the risks. So it doesn't, it's quite illogical. So we call upon SRC to live up to their constitutional mandate of bringing fairness and bridging that disparity that we have within the healthcare sector and payment of allowances and emoluments.
Thank you so much. Thank you so much, sir. Wambiru, I've been speaking with the president, the National Nurses Association of Kenya, and of course in support of the industrial action and the grievances being raised by the nurses across the country, but his concern is on the leadership in the union, the Kenya National Union of Nurses, and saying the way these issues are being addressed, then it's not properly, and therefore citing politicizing of the nurses' issues, the nurses who are having actually what he's saying, that the concerns that should be addressed by the government, the issue has been politicized by both the union and also the Council of Governors. But this week, the union did really express optimism that the new leadership of the COG, led by Embu Governor Martin Wambora, may resolve these issues, and therefore they were responding to the statement by Seth Panyako, the SG of the Union of Nurses, this week, who was maybe mentioning some personalities and trying to, what they are saying, unethically expose their medical situations. So that's it from this end. I'm Purity Museo. Jackie Wambiru, it's back to you in studio.